Dr. Upadhyay, members of the panel, ladies and gentlemen, good afternoon to you. Thank you, NG Box, for giving me this opportunity of coming and sharing some of my thoughts, and Dr. Upadhyay for already scaling me up for whatever reason known to him. But the idea is to share some ideas, some thoughts, which have come my way during this course of this morning sessions and now that we discussed of engaging businesses in healthcare partnerships. I heard Praveen very intently, and so did I hear about Carol speaking. Very incisive thoughts of how partnerships can actually be brought about. But what is important, I feel also, and I would subscribe to the fact what Carol alluded to, is outcome. It's not a number game. Water. We talk about dengue today. Everybody almost in Delhi and NCR region and areas around are suffering from dengue. Our own families, our helpers, our safaiwalas, our dhobis, or somebody else has been impacted with that. What have we done? When we talk about Delhi, yes, there's lots of funds available, best of hospitals, medical tourism, great. But who has got the access to that corporate hospital? The money that we are making in these corporate hospitals, are they getting engaged into the rural areas and doing out a service to the communities? And from my army background, I'll give you one small incident which actually brought a huge outcome. In Dras, if you've heard of, that's the coldest inhabited place in the world. I mean, we talk about, okay, medical institutions are available and there is government resources and leave it to them to do various things. But if you have got the resources, reach out, help the government to reach out. We talk about A&Ms and DNMs and GNMs, they're deployed all over the places. They're not available. Help them, strengthen them. And there was a little girl who had her chin flushed to her chest. And I said, what happened? It was in way out village, about 15,000 feet. And they said since birth, and she was about 14 years old. Zebu Nisa was her name. I said, have you shown to the doctors or to the other people around? Yes, Srinagar le gaye the, kuch hua tha, nahi hua tha. Not possible, but then that's how it is. Nothing else is available. We flew that girl across to Chandigarh. And within 5 months after plastic surgery and after everything that was done, she came back as a beautiful girl. The whole village was with you. I'm giving you a very small incident. We just shared our resources. We opened up various health clinics. We used to send our snow vehicles, snowmobiles, because we had that infrastructure, that resource to collect people and bring them to where the services are available. That's what corporate, I think, needs to do. When we talk about medical tourism, it's good to make money, but why can't we reach out to those who are needy, who are not getting access to both infrastructure as also to the medical resources? And that's where the corporations have to come and get engaged in. We need to really work towards preventive health care in a very major way. Now this, I'm saying we need to do. How many of us are actually doing? 2% of the PAT, or now they're talking about the PBT, profit before tax. The point is, are we using that money appropriately in the rightful way that we can impact the communities? That will make a change in the complete demographic profile and inclusivity of development and growth. I just feel that we have to actually work towards access in a very big way. Jindal Stainess Limited, we've got a hospital. We've got a hospital in the remote, well, not the remote, in Hisar. It's a 400-bed multi-speciality hospital, catering to the needs of the areas around the area of Hisar, Sirsa, where there's no facility available. Yes, those who can pay are paying higher amounts. Those who cannot pay have got subsidized rates for them. And then we have got mobile vans reaching out to the interior areas. We've got partnership with Wokhart in Orissa, who are actually engaged in reaching out to the villages around our plant locations in Orissa. We've got partnerships with Global Compact Concern. So those kind of partnerships are existing and we keep reviewing. But I find a lot of challenges too. In partnerships and monitoring, there was a talk in the morning about monitoring. Yes, NGOs partnership or a corporate partnering with us, working towards water, working towards health, which is correlated. The challenge remains who to pick up. We carry out due diligence process, we have credibility ratings, and we have this, that, and the other. But I think the challenge remains how to partner, with whom to partner, and then to get it right. And I just feel that technology has a very important role to play, but community relations and reaching out to the community through such partnerships and having a delivery mechanism in place, ensuring that your monitoring systems are also in place, would make this complete process much better, and a better collaboration will take place for overall benefits. So to conclude, I would only like to add that we as corporates are open to partnerships at the local levels also in healthcare. For example, in Save the Girl Child program, it's again a healthcare program. We have got partnership with an organization which is working towards building various awareness programs around the Save the Girl, Child and Female Feticide. That's also healthcare. We've got programs relating to cancer, detection, drug abuse. That's also part of healthcare. And we've also got programs to do with actual core preventive and tertiary health for our hospitals. Thank you very much, ladies and gentlemen.